compared with when my mum died back in 1985 from breast cancer, in one way, there's a lot between my treatment and hers that's similar. You're talking about surgery, you're talking about chemotherapy, you're talking about radiotherapy. So in lots of ways, pretty similar. In other ways, there's kind of been a revolution in cancer care. Talk to me about what's changed in those decades.
Well, I think the biggest thing that's changed is the recognition that we use those standard approaches in sort of a one-size-fits-all therapeutic paradigm. And we've learned that the disease is much more complex and diverse, and that what we need to add and ultimately replace with some of our standard therapies is personalized or individualized therapy based on that diversity. So understanding what's broken and treating that specifically, as opposed to throwing in a bomb and hoping you kill more bad cells than good cells, is what really has turned the whole field on its head.
So it's about understanding that there's not just cancer, there's not even just breast cancer, there's different kinds of breast cancer, many different kinds of breast cancer, and if you work out what's wrong, what's going wrong within each kind, maybe you can work out how to fix it.
That's exactly what's occurred, is the fact that we realized that the diversity in terms of outcomes for patients, when we use sort of the one-size-fits-all approach, was due a lot less to good luck or bad luck, good doctor or bad doctor, and much more to the fact that we were dealing with different diseases, even within a given subtype, within breast cancer. And we're learning the same is true for lung cancer and colorectal cancer and pancreas cancer, ovarian cancer, you name it, that there's a diversity built in, that there's more than one way to convert a normal cell in that organ into a malignant cell. And depending on which path was taken, the cancer can behave quite differently and respond quite differently. So one size fits all for sure is not going to work. The process of cell growth is phenomenal. And when you recognize that every cell in your body, save the germ cells, the cells that are used for fertilization, that every cell in your body contains a full blueprint for you. All the information that's needed is in that blueprint. Each cell has it. But every time a cell divides, it needs to copy that blueprint and copy it exactly correctly and make no mistakes in it. And there are genes that are part of that blueprint that make up the actual blueprint itself. And they can become mutated.
They can change and go wrong and stop working?
Exactly. They can become broken, or if you're thinking about the analogy again of a blueprint where when you look at a particular room, it's not squared off, it's out of kilter, something's wrong with the actual structure because a mistake was made whenever the blueprint was being made. You can accelerate those kinds of things happening by things like radiation or cigarette smoke or alcohol. You can make things happen more frequently, but even if you live the perfect life, every time a cell divides, it has to copy that blueprint exactly and precisely. And if it makes any mistakes in the wrong sets of genes, you're off to the races with the process we know as cancer. And the sets of genes we're talking about are those that regulate growth. So by analogy, there are genes in all of the cells in your body that turn on growth, and there are genes that turn off growth, and they make proteins that act as brakes, like in an automobile, or accelerators. And sometimes the accelerator's stuck in the on position. Sometimes the brakes are broken so you can't stop the growth. And sometimes both happen at the same time. And they can lead to all kinds of different kinds of cancers. And if you think, again, about the analogy of accelerators, there's several parts of that. There's the gas tank, there's the fuel line, there's the carburetor, there's the internal combustion engine itself that drives all this. And anywhere along that chain, things can become broken that can impact the accelerator part of it. The same is true with the brakes. There's the brake pedal, the hydraulics, and then the actual brake shoe that hits the wheel to slow the car down. And anywhere along that chain, things can become broken. Well, that's exactly the same thing that happens in nature. Anywhere along the chain of regulating growth, either making it happen or stopping it from happening, when those things become broken, you have dysregulated growth, or the process we know as cancer. We found a gene called HER2, H-E-R2, that was altered in about 20 to 25% of breast cancers. Now, this is something that happens that's not inherited. It occurs sometime during the life of the individual in the breast cells that's involved in transforming them from normal to malignant. And when that gene gets altered, the alteration is there's too much of it. And what it does is it makes a protein that's called a growth factor receptor. And again, by way of analogy, just like you described, that growth factor receptor sits like the old television antennas, if you will, that were on the roof of a house that receive signals from the outside and transmitted it to the inside, to the actual TV set. The HER2 protein is a growth factor receptor that's like that antenna. And then there's a wiring that goes from the antenna down to the TV set that's called the signal transduction pathway, or a fire brigade, if you will, where the signal gets passed from one to the next, all the way down to the nucleus, where the control center for these genes that regulate growth sit, and turn those genes on or turn them off to make the cell grow. So just during the course of the day, you're going to have a lot of cell growth in lots of tissues of your body, the skin, the hair follicles, for some of us at least, the gastrointestinal tract, the bone marrow. You'll make some 17 billion new white cells in the course of about 18 hours today. And if you get an infection, a signal goes saying you need more white cells. It'll go up to 40 or 50 billion new cells. And when the infection's cleared, the signal goes to shut that off. So the accelerator, the brake type analogy. Well, these are all regulated by genes that make proteins that are part of this structure, the actual physical structure. And if any of them are broken in the wrong way, you can switch on the process or switch off the process. In the case of switching it off, take away the brake system that you need to stop growth, or in case of switching on, stick the accelerator down to the floor, or feed too much gas into the line somehow. So it's understanding that and then figuring where that break is and treating it. So back to the HER2 story, it was basically looking for something that would act like a blanket, if you will, that sat on the top of that antenna and stopped it from receiving the growth signals from the inside. So there was still the mistake, there was too many antennas, but they were getting covered up by the drug to stop transduction of the signal, and it stops the growth. All women have estrogens at various levels, and some breast cancers are really driven by estrogen and abnormalities in the signal of the estrogen pathway. And our traditional therapy has always been, which has been effective for many women, has always been directed at the estrogen pathway. But what we learned is, just like we talked about with HER2, although it's a separate pathway, the pathway gets activated and it signals down to the nucleus. Once that information goes to the nucleus, or the control center for the cell, then the cell's told to grow and it has to go through the cell cycle. And in the cell cycle, there are checkpoints that tell the cell that it's okay to go on to the next part of the cycle before it ultimately divides. And all cells that divide have to go through the cell cycle. And what we found was that a certain number of breast cancers, in this case the hormone receptor positive ones, really depend on one of the checkpoints for their movement through the cycle. And when the patients have a cancer for which the therapy fails, that is estrogen driven, we now can catch it later, downstream at one of the checkpoints. And the checkpoint here is CDK4/6. So it acts like a gate that blocks the cell from being allowed to go through the cell cycle and divide. And what we found, and we're very gratified to see, is that when we use that drug in a very specific way for these patients that have these hormone receptor positive tumors that have not had the kind of response we want from hormonal manipulation or hormone therapy, that it works, and it works at a huge level. And what's been gratifying is it's, again, relatively safe, and we don't have the side effects that we have with other chemotherapies, and it makes a big impact. Any patient who's challenged with a diagnosis of cancer, their best tool in going to a healthy status or controlling their cancer or curing their cancer if that's possible. For many cancers it is information, being well informed. Frequently patients want to run away from information. It's scary. They don't want to hear the details. But nothing could be truer that what you don't know can hurt you than that whole approach. So you want to be well informed. Now, the problem is there's so much information out there that there's both good information and bad information. So you want to be correctly informed, and that's where your interaction with your physician is critical. And I think patients deserve to have things explained to them. And if you as a patient walk out of your doctor's office and you don't know what you're getting or why you're getting it, it's not only his or her fault, the doctor's, it's also the patient's fault. Sit there and have them explain it to you in a way that you understand and come up with a game plan together with your doctor, and that's the kind of information you want to have.